Hi everyone, this is Dr. Stefan. Welcome back to the channel. In this video, I'd like to talk to you about sarcoidosis treatment, notably corticosteroid treatment, or steroids as they're popularly referred to. So things like prednisolone. And in this video, I'm going to answer a question that I received on the channel. Very good question, a very commonly seen in practice, this scenario that's mentioned in the comment that I received. First of all, I'd just like to say that in the case of sarcoidosis specifically, it's very much so a case of shared decision making when you are changing treatments. It's really, really important to keep that in mind. The reason why I'm saying that is because you need to really talk to your doctor to see what's the right treatment for you. There is no rule. Unfortunately, we don't have very good, clear guidelines for the treatments of sarcoidosis. So this is why I cannot answer precisely whether you should implement some changes or not, because it depends on a case-by-case basis. Some people, for example, don't require any treatment at all for sarcoidosis. So this is really, really important. Some people do require more aggressive treatments. Treatments may go up, may go down. It's really important to see all the nuances. So please talk to your doctor about your treatment if you are having concerns. This is the best way. Let me read you the comment, and I can give you a little bit of insight into how your doctor may think about treating these cases. So this is the comment right here. Hi, Dr. Stefan. Thanks for sharing information about alternative treatments for sarcoid, because there are other treatments besides corticosteroids. So this is what I meant to say in this previous video. So basically, the question starts from here. So this person is using Wisolone, which is basically prednisolone. This is just the name of the brand name of the medication, but prednisolone 10 milligrams, which is an oral tablet. You take basically tablets of prednisolone orally. This is the corticosteroid that you're taking for a very long time, obviously. No side effects other than getting weight gain easily. This is what the question says. But if they skip the medication, they get a runny nose, sneezing in a single day. I'm not entirely sure if this is related to the medication, because just skipping one day, I'll explain in a second why this. I don't think this is necessarily the case. And then the question is this one. Shall I try a steroid-sparing drug? As I tried reducing the corticosteroid to 5 milligram, but that didn't help. So the dose reduced from 10 milligram to 5 milligram, but that didn't help. So this is where I meant to say that there's a lot of nuance. Let me just start from the beginning. So now, prednisolone 10 milligrams daily is a fairly low dose of corticosteroids. Generally, 10 milligrams and below are generally considered relatively low dose steroid treatments for sarcoidosis. Now, obviously, there can be side effects when someone is on prednisolone, especially for a very long time, for years. Weight gain can be a problem. High blood pressure can be a problem. Diabetes, all these things can happen from long-term steroid treatments, even at a low dose. So a lot of things need to be taken into account. So people want to get rid of this treatment as soon as possible. Now, the thing with prednisolone is that it mimics some of the body's own hormones. So if we stop the treatment too suddenly, the body doesn't have a chance to ramp up the production of its own steroids. So this is really, really important, because when we're taking these tablets, the prednisolone tablet, the dose that we're taking is a lot higher than what your body would normally produce. So that means that the body adjusts. It's very smart in that way. It just adjusts and reduces the production of its own steroid. So this is really important. If you understand, this is quite important, because it explains why we cannot stop the medication suddenly. People who stop prednisolone treatment suddenly after years, they will experience a bit of discomfort. They need to reduce this treatment gradually. So we're gradually reducing the steroid treatment, gradually, while the body's own production increases. So we need to overlap it in an ideal way. Now, in practice, that can be a little bit harder than anticipated. So, for example, if you're on 10 milligrams of prednisolone and your doctor says that from the point of view of the sarcoidosis, everything's well controlled, and you're thinking to reduce the medication now, you are happy to go down. If you've been on steroids for many years, it may be that you can only reduce by 1 milligram daily each month. So it can be that slow, or even slower than that. So sometimes people do not bounce back really quickly after steroid treatment. So we need to reduce the dose very, very slowly. So for example, if you've been on 10 milligrams for 5 years, right? This is an example. It's a theoretical example. your doctor may advise you to go to 9 milligrams daily for a month, 8 milligrams daily for a month, then 7 milligrams daily for a month, then 6 milligrams daily for a month, maybe then continue on 5, do another breathing test, do some other investigations, have a consultation, see if everything's still stable, and then carry on reducing in this same fashion. In other circumstances, especially if the steroid treatment was shorter, you may go down from 10 milligrams to 7.5 milligrams for 2 weeks, 3 weeks, 1 month, then 5 milligrams. So that reduction can be faster. But it all depends on individual cases. Generally, though, prednisolone is a medication that has a long duration of action. So even if you reduce the medication, there is a lingering effect of the drug. So this is why when the comment mentioned that if they skip the medicine for a day or two, they get a runny nose and many sneezes. I'm not entirely sure if that's related. That could be hay fever, that could be an allergy to something, that could be something else that's not really covered by prednisolone. Of course, I don't have any guarantees. I don't know this person who's writing the comment. So again, nuances. But generally, if they've tried to reduce to 5 milligrams, like they said, I'm not entirely sure if that was a sudden drop from 10 to 5, which may have been too sudden. So that could have led to a flare-up of the sarcoidosis, so new symptoms coming back on, or the body not coping with that drop from 10 to 5, which may have been too quick. So either of these circumstances can be there. Now, there are some tests that can be run to figure out whether it's the own body's fault for not producing its own steroids fast enough. You can talk to your doctor about these tests if you need to, if you're struggling to get off steroids. But obviously, in most cases, we just try to reduce slowly. If you're getting symptoms, we go back to the dose where you were feeling well. And then we try again, slowly, slowly, slowly. So this is really important. Now, obviously, if the sarcoidosis is not controlled and you've been on, well, it's controlled on 10 milligrams, let's say. You've been on a dose of steroids, 10 milligrams, 15 milligrams, 7 milligrams, whatever it is, and you've been on that dose for a very long time and you cannot reduce it because the sarcoidosis starts to give you trouble again. You get more symptoms, you get more breathless, you get rashes, you get other things that are going on. Your calcium levels go up. It could be a number of things depending on your own situation. If you cannot reduce the steroids, your doctor may advise going on one of these corticosteroid-sparing agents. In many cases, this could be a drug like methotrexate. So this is one option. It's a medication that's taken once weekly. Obviously, it has its own set of side effects, but it does work on the sarcoid as well. There can be other treatments that can be tried as well. But with these other medications, what your doctor would actually try to do is start you on that medication while you're on the stable dose of steroids, on the stable dose of prednisolone, introduce the other medication, continue both in parallel for a bit, and then start to drop the steroids while maintaining the new medication. So this is basically the way it works. It's a very slow, gradual process. You have to taper one drug, increase the other slowly. So it has to be a little bit of a balancing act to try to get the right dosage. So this is where communication with your doctor is really important. And please do not take advice on sarcoid treatment, steroid treatment off the internet unless you know what you're doing, unless you know you've informed maybe your medical team about what you're planning to do. Because it's a lot easier then to manage things as they come about and to figure out what the reason for the symptoms is. So I think I just covered most of the things that are here in this question. But please, if you have further issues, drop a comment below. At least I'll try to explain how a doctor may think about making these changes to medication. And it's important to note that with sarcoidosis, it's a long-term game, unfortunately. So it's one of these conditions that may need treatment for a few years. Sometimes it can get better and the treatment may be reduced, stopped completely. Sometimes it may come back. You do require regular follow-up, potentially regular blood tests, especially if there were issues with calcium levels. This can be a problem with in patients with sarcoidosis. It's important to check whether the kidney function is fine, the liver function is fine, that the sarcoidosis is not affecting these other organs, that your breathing tests are stable, especially if it's affecting the lungs. So there's a lot of things that come into play when managing sarcoidosis long term. So hopefully this clarifies at least some of your questions. Again, if you have further questions, drop them in the section below. And I'd like to just say that I will try to move some of these questions related to sarcoidosis and other interstitial lung diseases, so these sort of conditions that lead to lung fibrosis, lung scarring, to another channel dedicated to this, which is Interstitial Lung Disease Info. So you can find it on YouTube here. There's also a podcast where I put the audio versions of those videos. So if you find that helpful, maybe go and check that out as well. Thank you very much for watching, and I wish you all the best and good health.